Hello, and welcome back to Health Without the System. I'm Dr. Tim Scott.
My name is Mia Scott. Welcome back, guys.
Oh, we have an exciting episode today. What are we talking about?
GLPs.
Okay. I like those. We've mentioned this before. We are involved with a company called Rixa Health. Rixa Health is truly a metabolic health company. That is our intent and purpose. We're going to grow over time into a fully functional medicine company as Mia and I complete our training and get a little bit more experience under our belts. We'll bring on some more providers. We have really big plans. It's going to be really cool. But at this time, we have done a lot of weight management because it's a really easy space to sort of fall into with functional medicine. Talking about lifestyle changes first and foremost is the key to weight loss, weight management, health, and happiness, in our opinion.
Yeah, I feel like we should go way back and kind of tell them how we established this company in general. So my husband and I, we actually worked for a few different platforms prior to that doing GLPs, which are your weight loss drugs, the semaglutide, tirzepatide. And it was done just the wrong way. I mean, we hated it. We were slammed appointments. I would see 4 to 6 an hour. These were first time patients, not appropriate. You just couldn't get out what you wanted to. Was just done the wrong way, very little education. It wasn't good. But we saw the writing on the wall and we're like, these peptides are changing people's lives, but it can be done the wrong way. We're business people as well. We love the medical field. We love everything that it can do to the body. So we're like, let's do it. Let's go out and see what we can do and have our own company and do it the right way. So that led us to Rixa Health, where we still use GLPs in our practice, but we practice significantly different root cause approach, looking at the whole body, looking at other disease processes, lowering your toxic load, all the things that are going to be beneficial to live the longest life that you possibly can.
Yeah, the last thing I ever want to be known for and what infuriates me the most are people who go to get a GLP-1 and companies like, here's your shot. See you in 3 months.
Yeah.
You know,
on a
here's your
titration schedule.
Yeah, here's your magic weight loss shot. Like, it is not. These medications are not magic weight loss drugs, right? They're tools. They're tools in a kit to help change your life, to help improve your lifestyle, and to help drastically change your metabolic health. We'll dive into that a little bit more, but let's just start with the basics. What are GLP-1s? Let's go from there.
Okay, so GLP-1, it stands for glucagon-like peptide, and we'll try to stay a little bit less scientific-y, but basically it's a hormone in your gut, and our body makes it. We just help you produce more of it when we are using these injections. But nonetheless, it does a lot of things for satiety, and especially when you're eating. It's a peptide that if you were to do the injection, you inject it right into your stomach. It talks directly from your brain to your gut. It helps do a lot of cool things, like suppress that food noise, but that's not really the breadwinner there. That would be the metabolic stuff that it does on the end. So
yeah, wait, hold on, time out, because you're getting way ahead of things here. You've also brought up the brain-gut axis already. Like, that's a huge thing in medicine. You've talked about some of the effects and receptors. Let's just go back to the basics for a moment.
I have too much in my brain.
Yeah, you're getting it all out. So you said a GLP-1, glucagon-like peptide. And then also, if you're starting to talk about tirzepatide, that acts at the second receptor, your GIP, your gastric inhibitory peptide. The reason I mention that is because sometimes you'll hear the difference. Tirzepatide may be considered a little bit more potent of a medication. I usually call tirzepatide semaglutide 2.0. It does have a little bit more blood sugar control, a little bit more weight loss, a little bit less side effects. For that, it tends to be a little bit more expensive. But that being said, they're both great medications when used appropriately. Mia mentioned that they are peptides, and they are. And that's really cool because there's this whole other category of medications that exist out there called peptides, which is also something that we do at Rixa Health. Not in the scope of this discussion today, but peptides can act in many different ways. They can act as hormones, neurotransmitters, different kind of signaling molecules, turn on enzymatic reactions, turn them off. They can do a lot of cool things, and semaglutide and tirzepatide are an example of that. A peptide is basically just a short little amino acid sequence. It's a little bit smaller than a protein, and it does have the ability to turn things on and off and to communicate with many different areas of the body.
Yep.
Mia mentioned that we have GLP-1 in our body. And what the pharmaceutical companies are able to do is actually make it in a way where it's not broken down as quickly. So it lasts longer in our body. It has a longer half-life. And that's how these medications can help to have their effect.
So once again, our body does make it. We just have a little bit more production when using these. But what are some of the benefits that it does? Like I said, when you're injecting this peptide, or in general, what this peptide does is it has a pretty cool metabolic mechanism. So better insulin glucose exchange, meaning that it can have a more insulin sensitivity, which is huge when it comes to these metabolic issues. And if you've listened to any of our other podcasts that we talk about glucose and insulin resistance or quite literally any metabolic disease process, that can make a big difference for some of these people who have fatty liver, type 2 diabetes, sleep apnea, high cholesterol, high blood pressure, all the metabolic issues. And it can really help get that homeostasis back to your body.
Yeah, we have GLP-1 receptors all over our body, right? It's not just in one specific organ. So when you're injecting this medication, it's really speaking to multiple different areas. And Mia mentioned what you notice the most and what people talk about the most is probably the receptors in the brain. So it's going to reduce what we call food noise. And food noise is what tells you to go to the freezer and eat some ice cream or to take another helping of a hamburger or French fries or whatever it is. And it reduces that food noise and it makes it easier, especially if you've been living a way in which you haven't been making the best food decisions. Maybe you've been getting too much glucose, too many fats, too much food in general. It helps make the transition to a healthy lifestyle easier by reducing some of that food noise. And that's just step one. And that's going to lead to a reduced caloric intake. And a reduced caloric intake is great if you're taking in 3,000, 4,000, 5,000 calories a day. We don't want to reduce that caloric intake too much. No diet is ever rooted in starving yourself. That is never going to be a good diet. And same with us. A diet should be rooted in getting plenty of whole, nutrient-dense, healthy foods. And this helps you change to that.
Yeah. And we'll talk about what that looks like in our program here with Rixa and how we use this as a tool for our patients as well. But it does more than just that. There's cardiometabolic effects to that. There's renal protective, so it can help support your kidney function. It really does a lot. The biggest one that I feel like my patients say is the anti-inflammatory effect. I've had many patients that have autoimmune issues where they say my joints automatically feel better, my rings are fitting better, my clothes are fitting better, my face looks a little thinner. It's just that inflammation that if you're living the standard American diet, you're carrying around that inflammation. So that can really help with some of those things. So GLPs are just rock stars when used correctly.
Agreed. So there are published data out there, published studies, and the average person on semaglutide over the course with lifestyle changes, over the course of the study, the average person lost 15 to 20% of their weight, and then you were upwards of 20 to 25% of the weight with tirzepatide. These are very powerful drugs. Now, one of the things that they noticed early on and wasn't really talked about was the fact that people were losing quite a bit of skeletal muscle mass. So in order to set the scenario here, you have to understand that on the average caloric restricted diet, if you're just like, I'm going to eat 1,000 calories a day and I'm going to lose weight, the average person, the weight that they lose, let's say you lose 10 pounds, 30% of that or 3 pounds is going to be
muscle.
Yeah. 30% of that is going to be muscle. You want it to be as much fat as you can. But you have to understand that when people are going on these calorie restricted diets, you're probably going about it all wrong to begin with. And that's why we never encourage that. And at the beginning of this, people were losing upwards of 40 and 45% of the weight that they lost was in the form of skeletal muscle. Now, once people realized that and stepped in and started correcting that in the form of, okay, you have to have protein, you have to put resistance against your muscles, that got a lot better. And when I talk to a lot of my patients, I stress to them, you don't have to do anything heroic on these medications to preserve skeletal muscle mass. You just have to be aware that when you're dieting, when you're changing your food intake, when you're trying to lose weight, you want to preserve muscle and you want to lose fat. What's the number one way to do that? Okay, a protein heavy diet, exercise with weight resistance to your ability. We have 80-year-olds. We have an 80-year-old woman. She's a wonderful lady. Through our program, she's lost over 30 pounds and less than 10% of her weight loss has been skeletal muscle. She's actually gained skeletal muscle.
And that's an 80-year-old.
An 80-year-old lady. And she's done it through diet and exercise to her ability. She's not bench pressing the same thing as me, but well, maybe she is. I don't know. But the point
she's
is
knowledgeable.
Right.
And when you understand how that breakdown happens, you can correct that, which is why programs out there that are not teaching you how to correct that or what to be aware of, I mean, those are immediately red flags because they're not going to care about your muscle mass. And the more muscle that you lose, number one, the harder it is to get on the older that you get. And number two, we need that for so much. Like we were talking about in our last podcast, that better insulin sensitivity. Your muscles need that for glucose. And the less muscle you have, the less bone density, you can be at risk for osteoporosis, osteopenia, all of these things that can really have a downregulation of your body, the less muscle you have. Of course, we want to preserve muscle. But with that being said, I just want to elaborate on what Tim said. On any single diet that you do, any weight loss journey that you do, if you're not aware, regardless of medication or if you're on any, even if you were to just do it with lifestyle, if you are not paying attention to what you're eating, any diet that you lose pounds, that you can lose muscle mass. So it's just being educated and aware, but they really do get a bad rap for saying it's going to take all your muscle mass and you're going to wither away. Maybe if you're not educated about it, but if you do it the right way, no, you can actually gain muscle on our program.
Yeah, and I've been a huge proponent of these meds since the very beginning. I hope we continue to study them, and I hope people get to continue to use them because, as Mia mentioned, we do have receptors all over our body. So there have been even more studies done and more studies released that do show reduced risk of cardiovascular mortality, strokes, and major cardiovascular events, which is really a big deal. When you start talking about a medication that can reduce weight, reduce risks of morbidity and mortality from the most common diseases, what Mia calls the standard American diseases, that's a big deal. And if you can do that, if you can use that tool in conjunction with reforming your metabolic health, reforming your diet, the fuel you put in your body, to me, that's how you're going to do it. That's a winning formula. And at Rixa Health, we've taken care of, I think we're over 800 patients now in the year and a half we've been doing this, or 2 years now. And we have really good results. We're not done talking about this, just sort of going in tangents here as we speak.
Sure.
We'll talk about Rixa. We'll talk about some of our patients in a minute. But let's just go back and speak for a minute. It's not just reducing your desire to eat. It's not just reduce caloric intake.
Right.
It's that metabolic effect. It's actually, you have GLP-1 receptors in the liver, right? And the liver is sort of like the quarterback for metabolism in your body. Mia likes to talk about the way we're processing, these fatty acids and turning them into triglycerides and cholesterol and what we mobilize and what we store. This medication has the ability to talk to the liver and help it change that. Gluconeogenesis, glycogenolysis, all of these processes are important when you start talking about homeostasis and metabolic health. This medication acts on that. Some of the other organs, what else do you talk to your clients about?
It really helps with anything that's inflamed. And there's many disease processes that help this. So for one, a lot that I get would be PCOS. It is so common. But PCOS, it's a lot of times not addressed because the root cause is actually, majority of the time, insulin resistance. Because when you're insulin resistant like that, your ovaries will actually produce more testosterone. And of course, you're not going to be ovulating or have a cycle if your testosterone is in a man's range, elevated. So there's things like that where it just addresses the root cause. So I get a lot of patients with all different comorbidities, whether that's sleep apnea, of course, losing weight, you're going to breathe better. Cardiac issues, better functioning of the heart. Of course, you're getting weight off, you're getting some fluid off, and things that are very detrimental to your body. Renal function. I've had patients that have increased in renal function that were in kidney failure because of those changes that they're making, the free up of the liver that it can help do. And it's truly a systemic effect. Typically, we like to see patients off of all medications. So for instance, we get patients all the time that come with us on statins, high blood pressure medication, even metformin, maybe they're already pre-diabetic, and we expect them to be off of everything by the time that they're done. If they do diet and lifestyle change, listen to us, and they can really change their life because all of your organs will talk to each other. So when you're inflamed or having these cells not be able to communicate or do their job, your backup is going to be wherever it needs to be. So the GLPs quite literally work on, I feel like, almost every single organ that we touch on for metabolism.
Yeah, I agree. And one of the things that you can't see would be the gut. And we talked about inflammation and how there's this inherent anti-inflammatory effect in GLP-1s. And I think not only is there some improvement in just inflammation in the gut from the medications, but as you make some of these lifestyle changes and as you improve your diet and reduce the things, some of the bad stuff that you're eating, we've talked about fried foods, greasy foods, seed oils, excess amounts of glucose, all of that, as that reduces, we've talked about how junctions in your gut can get really loose. Those can start to tighten back up. Your body has the ability to heal itself. So you can get that back together. Now, all of a sudden, that's going to reduce what is getting through those junctions and what's being seen by your immune system. And then you start to think about some of these autoimmune disorders and chronic inflammatory disorders, from irritable bowel syndromes to rheumatoid arthritis.
Hashimoto's, the GLPs are great for suppressing some of those immune issues that are happening, because the more that you can keep inflammation down, the less your immune system is going to be fighting and battling off something.
And people will come to us, and you don't always have all of these diagnoses, right? Sometimes you've done testing and found levels of antibodies on people. Like if you're testing thyroid antibodies, you found them to be just above the range of what's considered acceptable. And so this person, clearly they have antibodies they shouldn't have in a range that another provider wasn't even testing for. So they do not have this diagnosis, and they might not have a severe form of Hashimoto's thyroiditis, but clearly they have a form of it, and they're having some autoimmune effects, and they're having a change in their thyroid function. And they didn't know that. And by coming to us and starting on this program, by using a GLP-1, by changing their diet and their lifestyle, they might cure it without ever even finding out. You might have never done the blood work on them, but now all of a sudden their stubbornness in losing weight has improved, their fatigue has improved, their emotional state is regulated, their sleep is better. And you didn't give them a sleep medication and a stress medication and an SSRI. What you did was you addressed the root cause. And that's what I find cool about these medications. There are a lot of undiagnosed problems in people that get, number one, undiagnosed, so nobody does anything about it, or number two, get covered up with a pharmaceutical that's supposed to just treat the symptom instead of the cause.
Yeah. And as the years go on, we're seeing some really cool research on the GLPs in general. So first years ago, decades ago, it came out obviously for the diabetic medication. But as I studied this more, there's so much that this can help. For instance, they're even looking into, of course, we know the sleep apnea and all that thing, but they're looking into this as even like addiction. And I have talked to many of my patients that have just some weird things, like whatever like your tick or your thing was, that your addictive property, even whether that's food or not, or drugs or alcohol. I had a patient tell me that she was a chronic shopaholic, and she's like, I don't know how, but I've like this entire month I didn't shop at all, and she was like majorly in debt. She's like, you guys saved my marriage, and we're like, okay, it's just like a side bonus. Like, all right, that's great. So it really does just some crazy things that we can't even put on paper yet, but it's continuing to be studied for. What else can we use this for? Mental health and the addiction properties.
Yeah, alcohol is a big one. I think there's a lot of people that consume alcohol in what is probably considered a normal way. But to me, what's normal is excessive. And I think that's the American way. Things that are normalized are probably done in excess. And drinking alcohol every night of the week is probably too much for your body. I think that's putting too much on your liver. Remember that alcohol is getting broke down into sugar. We've had conversations about that. But then there's the toxic byproducts of alcohol during the breakdown process. Then you put those effects on your liver. And now all of a sudden your liver can't metabolize appropriately. And now we start talking about mitochondrial dysfunction, oxidative stress, all the buzzwords. If you've heard us say this every time, it all comes back to what you put in your body. I digress, as I usually do. My point was alcohol. I've had a lot of people tell me when they start GLP-1s that they have drastically reduced their alcohol consumption by simply not desiring it. And over time, when you're on these for a few months, you start to realize, wow, I was drinking a lot of alcohol. And I've had countless people get 5, 6, 7 months into this program, and even when they're done, never drink the way they did before. They might
eat the way they did, which is our goal. Like, you have to change lifestyle, because of course, if you don't change anything to get to where you got to in the first place, you have to be on either lifelong or you're going to rebound. So that's our goal, is to absolutely teach you lifestyle, because no diet in the history of diets has ever been sustainable. So our goal is to make it a lifestyle change, because nobody wants to be on medications for lifelong, and you don't have to be if done the right way.
Yeah. A patient was saying that to me the other day. I kept correcting her. We were on a follow-up call, and she kept saying, well, normally when I diet, and I kept saying, dear, you're not dieting. Yeah. We are going to help you change your lifestyle. This is going to become the new normal for you. Let's do it in a way that's sustainable. And we stress that. We are never going to encourage you to crash diet, clean out all your cupboards, remove everything bad. Like, let's do things stepwise, one thing at a time, what you're comfortable with. We're going to help you go down that pathway of true life change. You made me think of a very common question that people have. When I stop this medication, am I going to gain all the weight back, right? And the answer is,
that's up to you.
Yes or no. Yes or no. Yeah, go ahead. Talk about
Yeah, that's what I was going to say. It's truly personal dependent. And once again, like every single month when we have these follow-up calls, number one, our initial call, you get a pre-video visit, you dive into what it looks like for a healthy lifestyle, diet, exercise, about the medication, all the things. And then during that visit, or after I should say, you're going to get an after visit summary that has a ton of resources to keep you accountable to some of those things. And at every follow-up, we're asking, how's your protein intake? How's your water intake? What are you doing for weightlifting? And I'll have patients straight up say, "Mia, I got to be honest, I was terrible this month." That's okay. They know exactly where they need to be, and it is what it is. Life is crazy. But the goal is, we are your accountability partner every single month. And I always stress to my patients, find your accountability partner that's not just me, your family, your friends. Because when you make this a lifestyle change, you will start to find your circle of people. Because what is that saying? That you become who you hang out with. And you really want to start associating with those things that can make life easier for you in general, especially on your health journey. And I get a few times where patients will say, my husband doesn't really support me, or whatever. It's hard. My husband doesn't have any desire to change. And that can make things hard. But bottom line is, when it comes down to these medications, like, however long you want to be on them is simply down to your lifestyle. And that is what we're going to get on. The root cause of you have to make a lifestyle change. Like I said before, you don't change anything, you're likely going to be a lifelonger on this, or you will gain weight back because you didn't change a thing to where you got to in the first place. But if you do change lifestyle and you do address looking at food completely differently and longevity and lowering your toxic load and avoiding some of the things that you build habits with and carry lifelong, you don't have to be on this medication for life. That's not our goal.
Yeah, absolutely. And I think there's a really important point to highlight here. And I try to explain this to people as much as I can. Let's say you lose 10 pounds. Let's say you went bigger. Let's say you lost 100 pounds on a GLP-1 over the course of a year and a half. And let's say 10 pounds of that was muscle, which would be great, and 90 pounds was fat. Now, if you go off of the medication and you resume your previous lifestyle, the odds that you're going to gain muscle back are very low. The odds are that you're going to gain fat back. So this is what I tell people, that I really want them to be committed to this, because in the long run, if you lose a bunch of weight and then you go off of the medication and you haven't changed your lifestyle and then you put fat back on, think about that. You're actually going to replace some previous muscle with fat as you go. Over the course of the long haul, you're going to end up increasing your body's total fat percentage. So you will have done yourself harm. Again, I do think it's very important for people to understand the importance of a protein-based diet, the importance of skeletal muscle mass, weight resistance exercise to your ability, and lifestyle change. And listen, we're not the police. I can't make you do it. I'm not coming to your house and monitoring it, but I do think that a program like us is very good about explaining this, explaining the why, supporting our patients the entire journey. And I think if you are interested in a GLP-1, that's what you want to find. Whether it's us or somebody else, no big deal. I encourage you to go wherever you're comfortable, but those are the things you should be looking for.
Yeah, and making sure that they're giving you the right education. And not everybody can exercise. You know how many times that we work with elderly patients, especially because they come to us, why? Because they are needing to get a knee replacement or a hip replacement and can't lose weight, but their GI doctor who wanted them to have gastric bypass, or their ortho who wanted them to have their knee done, say, I can't operate on you until you lose weight. And now what? They send him home and say, lose 50 pounds and come back when you're 50 pounds less. How is that going to happen? They can't walk. They're on bone, their quality of life. So we'll get a lot of patients like that come to us and say, I don't know what else to do. And you have to look at risk versus reward. But even some of these patients, I'm like, you're sitting on your couch, lift your weights, whether that's your little mini weights on your dumbbell, shuttle around as much as you can, and focus on protein. Do what we can do, control the controllables, because as you lose weight, of course, this activity will come. And we've changed a few lives with the ortho replacement, and the one I had a follow-up on her just a couple months ago. She's been with us for probably a year and a half now. But it took 5 or 6 months, and then she finally got approved and got her surgery, and it changed her life. And imagine if she didn't get approved because she couldn't lose her 50 pounds, because how can she when she's non-mobile? And it's patients like that. You'll have your one-off that, yes, you might not be able to go out and lift weights like that, but quality of life, doing what you can, increasing your protein, moving when you can, it really makes a difference.
Yeah, you mentioned the insulin resistance earlier, and we've had quite a few different PCOS patients, or maybe even, like I said, sometimes people will come to us and they'll have a diagnosis that they don't know they have yet. So this person said, I've been struggling to get pregnant for so long, and maybe they haven't been diagnosed as PCOS or insulin resistance. We run a few labs. Clearly, we can tell just from the basics, that's probably what's going on. The labs lead us to insulin resistance. They do some months of semaglutide or tirzepatide, lose weight, and magically become pregnant. So you're changing lives in that respect as well. Again, I think this just kind of points back to, there's a lot of pharmaceuticals out there. There's great ones, there's good ones, and there's bad ones. I think this falls in the category of a great and helpful pharmaceutical medication. And this is why I don't think I'll ever be completely against the pharmaceutical industry. I'm just sometimes against some of the tactics that are used and some of the protocols that are out there that don't really address the root cause. They don't address the root cause of illness. They just give you a medication that's supposed to cover it up or fix it. And this is actually one instance where I think you can get to the root cause. The medicine itself isn't going to fix the root cause, but it's certainly going to help you change it.
Yep.
And help you change your life.
Yep. It's a tool in your toolbox. And like I said, we said all the time, and it's not any news. Our podcast is literally titled Health Without the System. We aren't really in full support of Big Pharma the way that they do things. We gave them an inch and they took many miles, and they actually do quite harm to a lot of patients. But we understand that there is major change with these peptides, and we're very happy with that. And we have our few other things. There's multiple other peptides and a few medication that you agree with, but there's nothing like this. And it's been really incredible to watch our patients over the last few years help change their lives.
Yeah. And so that kind of brings up the conversation of the fact that Obviously, if you try to get these, if you get prescribed by your standard primary care physician and your insurance says that you do not qualify for the medication, you're left paying out of pocket, which can be anywhere from like $1,100 to $1,500 a month, depending on the medication. Sometimes they'll give you a coupon for the first couple months to get it cheaper. So that's why companies like us exist, so that we can be a bridge and help provide access to the compounded medications from compounding pharmacies. And again, when you're looking for a company, when you're choosing a company, you do want to know where they're sourcing their medications. You want the pharmacies to be US based, FDA regulated. Even though compounded medications can't be FDA approved by nature, the pharmacy in which they're produced in can be regulated by the FDA. They still have to follow all the adherence of every other standard US medication, meaning sterility, concentration, production. It all has to be systematic, and they do batch testing and things like that before they can release the medications. So you want to make sure you know where your medication's being sourced. That's another thing we do at Rixa Health. Every time we give you a prescription, we make sure you know the name of the pharmacy. You have their website, their phone number. You can call them up and say, I'm Joe Schmo. I want to check on my prescription. And they're able to give you that information. That's an important point. And it also makes me think about how even if you do get the medication from your primary care physician and you do qualify and you get it from your insurance, that's awesome. I think that's great. And I hope I'm seeing it more and more where primary care physicians are able to provide you some, not quite to the level that we're able to in terms of changing your metabolic health and being on a good system, but please ask those questions. And if you aren't getting that, if your doctor just gives you the prescription and says, here you go, please on your own, do some research, listen to the things we're saying, look up these protein diets, muscle mass, make sure you are informed so that you are doing this healthy.
Speaking of, we forgot to mention on our in-body scans in general. So that's another thing that we love to do with our patients is track with a body composition scale. We have some local places that have a big, nice in-body scan that we send them to, and they can get it done no problem. There's also body composition scales too that we can send to their house to track that. We're looking for visceral fat, muscle mass, making sure that we're losing weight the right way. And if you get a patient that might be teetering that, are you losing too much muscle? We'll come back around and say, listen, you got to increase your protein, you got to increase your weightlifting. These are numbers that we track, and it's super beneficial. Is it mandatory or you have to? No, but if you're on this journey, you want to do things the right way because this is not a Band-Aid approach. We really try to make it a lifestyle because nobody truly wants to be on any pharmaceutical lifelong.
Yeah, especially when injection once a week. That gets old. Yeah, you mentioned the body composition scale, and I encourage everybody listening to this to grab one of those. They're not super expensive. You can find them on Amazon. We ran a promotion for a while where we were sending every one of our new clients a body composition scale if they didn't already have one. And like Mia said, the goal behind that is we don't just care about your weight. We care about your visceral fat, which is the fat around your organs. We care about your skeletal muscle mass, the actual weight of skeletal muscle on your body, because as we've mentioned in the past, skeletal muscle is the key to longevity. It's the key to health. It's a sponge for glucose, soaking it up out of your bloodstream. So we want to track these numbers, and we ask our clients to track them each month. And like she said, we're not going to fire you if you don't, but if you want to get the most out of this, you certainly should be doing that. Body composition scales are cool. I encourage you to grab one, note what your skeletal muscle mass is. If you're on any sort of weight loss journey on your own, make sure you are preserving your skeletal muscle mass week over week. As your weight goes down, you want your skeletal muscle mass to stay as close to the same as it was as possible, eventually even adding skeletal muscle mass back on.
Yeah, and this is something that we didn't really touch on, but I think it's important. And even if you're with another program or you decide to go with another program or already on these GLPs, if you hear things like, I'm sick all the time, I feel like crap, I'm vomiting, bedridden on the couch, like chances are something is not right. Whether that's bad sourcing, whether that you're at a way too high of a dose. We see this all the time where patients will come from a different program. They're on the max dose. They're like, I don't tolerate semaglutide. I want to try the tirzepatide. And I will say, why didn't you tolerate that? What dose are you on? I'm on the max dose. I've only been on it for 2 months. Okay, there's your problem right there. So you'll get these programs that will give you like a 3-month batch and say, we'll see you in 3 months. This is your titration protocol that maybe week 1, 2, 3, you're taking this much, 3, 4, whatever. And they just do it. When in reality, a lot of my patients will hover first or second level for months because if it's not broken, don't fix it. And you want to keep those cell receptors naive and decrease side effects because more medication does not necessarily mean more weight loss. It truly just means more potential side effects and feeling miserable. So if you are currently on a GLP and you're not comfortable, meaning like you don't feel good on your GLP, check out another place or check out us where we quite literally can change around dosing or manage the dose or the amount that you do or how many times you do it a week and things like that, what really makes a difference for people. So
yeah, we are truly a custom weight management program.
Yep.
I think some other companies might say that, but then you don't actually get to speak to a provider, or they don't actually provide you personalized care and protocols. We genuinely will customize the program for everybody as needed. We can do completely custom dosing, titrating schedules, maintenance schedules. We're a little bit flexible in what we can prescribe for, right? Like we've talked about all the different anti-inflammatory effects, metabolic health, a lot of cool different things that these medications can be used for in an appropriate and safe manner. I think there's some really cool benefits out there when you're with a company like that.
absolutely.
Yeah, I think the last thing to mention might be there's been a lot coming from FDA regulations and being able to compound these medications. So without diving into it, I'm not a lawyer, I'm a doctor, and I don't want to overstep or say anything I shouldn't say. But right now, the pharmaceutical companies that originally patented these medications of semaglutide and tirzepatide are trying to stop the compounding pharmacies from producing them. It's sort of like a legal battle. You know, it's a matter of verbiage, advertising, claims about what the medication can do. In general, a pharmacy should be able to compound a medication that has been FDA approved. And in the past, it's traditionally been able to. So some of the pharmacies are fighting back and saying, no, we can do this. We'll see you in court. Other pharmacies did not want any legal battles. They don't want any trouble. They stopped compounding the medications, and they'll see what happens in the future. So if you've been told by a provider, hey, I can't provide semaglutide or tirzepatide anymore due to this, it might just be the pharmacy that they're working with. Currently, we work with US-based FDA-regulated pharmacies that are continuing to compound the medications. They do believe they are in the right. They will take the cases to court, and we'll see what happens. So ultimately, I'm not sure what will happen in the future, but right now we can continue to provide those medications.
Yeah. And theoretically, because he said compounding in general, so that means adding something like the B12 or B6, our pharmacies can do that. And some of these pharmacies that we have worked with in the past or that I'm familiar with had to shut down because they only had semaglutide or only tirzepatide. And essentially, you can call that into your local pharmacy as a brand name. So it'll be interesting to see what the future holds. But personally, I think the demand, I do not see how GLPs can go anywhere anytime soon, especially because I feel like if they do come off the shortage list seriously, then how can you keep up with this? I feel like it'll go right back on the shortage. It won't be a matter of time. They can't keep up with producing.
Yeah, well, the issue's not the shortage list at the moment.
Right.
They've been removed from that. But
yeah. Yep. So we'll see what happens. All right. Jinx. All right, guys, just a reminder, this podcast is for informational purposes only and is not medical advice. It is not a substitute for professional care, diagnosis, or treatment. Always consult with your healthcare provider before making any changes to your health routine. Remember that you have the power. Join in next time to get more knowledge.
Yes, and please, if you feel so inclined, go ahead and give us a rating, leave a review, share this podcast with a friend. Check out www.rixahealth.com if you want more information on the things we talked about on this or previous episodes.
Yep. Thank you, guys. Till next time.